Hello. I would like to welcome you to today's webinar hosted by Hep B United and the National Association of County and City Health Officials. My name is Michelle Cantu, Director of Infectious Disease and Immunization at NACCHO, and I will be your moderator today. Before we get started, I would like to take a moment to remind all participants that during today's webinar, you will be in listen-only mode. You may use your computer audio or dial in with the numbers on the screen. At any time during the presentation, you can enter questions into the Q&A box on the right-hand side of your screen. Questions will be addressed by the speakers at the conclusion of the presentations. Recent data indicates that there has been an increase in the rate of new hepatitis B infections in the U.S., which many largely attribute to increased injection drug use. To address this, Hep B United and NACCHO are excited to present a three-part webinar series on local strategies to eliminate hepatitis B virus infections. Thank you for joining today for part one of this series, The Landscape of Hepatitis B in the United States. During today's webinar, we will discuss the epidemiology of hepatitis B and at-risk priority populations, describe hepatitis B testing, treatment, and prevention measures, and characterize the role of local health departments in preventing and eliminating hepatitis B infections. We'd also like to make this webinar more interactive, so stay tuned for opportunities to participate in polls throughout the webinar. Our presenter today is Sierra Pellecchio. Ms. Pellecchio is the Health Outreach Coordinator at Hepatitis B Foundation and the manager of a global hepatitis awareness program and a CDC-funded initiative creating hepatitis B educational materials to address healthcare barriers in African immigrant communities in the U.S. She's also co-chair of the Bucks County Immunization Coalition and works closely with local health departments in Pennsylvania to promote hepatitis B and vaccination education. Her public health expertise lies in creative health promotion and community outreach in minority populations at risk for hepatitis. Sierra is Certified Health Education Specialist and received her BS in Public Health in 2016 from Temple University in Philadelphia. Before I turn the presentation over to Sierra, I would like to provide some background about NACCHO and how local health departments serve as community health strategists within their communities and play a critical role in hepatitis prevention and treatment activities. NACCHO is comprised of nearly 3,000 local health departments across the U.S. Our mission is to serve as a leader, partner, catalyst, and voice for local health departments. While NACCHO has many different programs within public health as displayed here, the hepatitis work that takes place at NACCHO primarily lands under our infectious disease program, and our perinatal hepatitis B work is primarily focused within our immunization team. The teams focus primarily on advocacy, partnerships, funding, training, and education, networking, resources, tools, and technical assistance. Local health departments are on the front lines of addressing viral hepatitis from prevention to care and continue to play a key role in moving our nation closer to the goal of eliminating viral hepatitis as a public health threat by 2030. Local health departments do this in a variety of different ways. They do this through surveillance by documenting the epidemiology of viral hepatitis, producing estimates of the incidence of hepatitis B and C, and developing information about population-specific health disparities. Through vaccination and testing, by vaccinating people for hepatitis A and B, testing people for hepatitis B and C, and following up with persons with viral hepatitis and linking them to appropriate care and treatment. Through treatment by supporting access to hepatitis B and C care and treatment. Through education and prevention by developing and disseminating educational tools, trainings, and resources to increase community and healthcare provider awareness of prevention, testing, and treatment methods. Through outbreak response by working to detect, investigate, respond to, and minimize the impact of possible outbreaks. And by elimination planning by collaborating with federal, state, and community partners to develop coordinated, comprehensive, and integrated plans to eliminate hepatitis B and C virus. Now we're about to begin our presentation, but first, let's look at who has joined us today. So you should see now a first poll question. Which of the following best describes your job title? Perinatal hepatitis B coordinator, disease intervention specialist, nurse, epidemiologist, or other. At this time, please feel free to click which one best describes your job. All right, and with the poll shows that we have quite a few nurses among us. We also have some that identified as other perinatal hepatitis B coordinators. We have some epidemiologists and just a few DIS folks. Thank you for joining today. In our next poll question, we would like to know the type of size that your jurisdiction is serving. So if you're representing a health department, please tell us about your jurisdiction, the population size you serve. And the selection sizes are small, medium, and large. All right, we see quite a few, at least 40% large jurisdictions, followed by medium, and then followed by small. Finally, for our last poll question, we'd like you to describe your community. The options are rural, suburban, and urban. All right, and with this poll question, we see about 40% representing urban, 32% at suburban, and 28% at rural. Thank you to everyone who participated in our polls. And now I'll turn it over to Sierra for our presentation for today.
Thanks so much, Michelle. And thank you to NACCHO and Hep B United for co-hosting the webinar with us. The concept for this webinar series was inspired by our interactions with local health departments and requests to provide information and resources specific to health departments' work in their communities, working to prevent, manage, and eliminate Hep B. Hepatitis B can be complicated, and it's in this part one of our webinar series, we'd like to provide an overview of the virus. And with that, I'd like to jump into the presentation. Next slide, please. So first, I'd like to give you a little bit of a background on the Hepatitis B Foundation. We're located in Doylestown, Pennsylvania, which is a suburb of Philadelphia. We're the only national nonprofit dedicated solely to improving the lives of hepatitis B patients and those affected by it worldwide. Our public health and community outreach team consists of 6 team members with support from our communications and development team. We have a research arm of our foundation too called the Baruch S. Blumberg Institute, where we have about 50 scientists working mainly on hepatitis B and liver cancer research. Our focus is to raise awareness about hepatitis B and promote vaccination and testing and support to those who are already affected through education and connection to resources. Next slide, please. I'd also like to give an overview of our Hep B United. So we, as the Hepatitis B Foundation, manage a national coalition called Hep B United. This coalition consists of about 40 local coalitions and national organizations in 20 states. We provide capacity building, resources, and support to member organizations with the goal of reducing health disparities and associated morbidities with Hep B through disease awareness, screening, and linkage to care for these high-risk communities. Next slide, please. Health departments play a very important role in preventing and eliminating hepatitis B because they are notified of all new cases of Hep B. Perinatal hepatitis B coordinators are required to provide case management for all pregnant women who test positive for hepatitis B to ensure the health of the mother and to prevent the transmission from mother to child during birth. And depending on the funding, health departments can have varying capacities to follow up on acute or chronic hepatitis B cases in non-pregnant women. Health departments are essential, and they're on the front lines in fighting Hep B, and you're in a unique position to provide education and navigate patients to appropriate care and management. Next slide, please. So just going back to the basics, what is hepatitis B? It's a virus that affects the liver and can lead to liver damage or liver cancer over time. Although it's vaccine preventable and treatable, there are still 32 million people who become newly infected with hepatitis B in the world each year, and only about 5% receive treatment. Globally, there's nearly 300 million people living with hepatitis B, with 1 in 3 people having Hep B in their lifetimes. Next slide, please. So why is the liver important? Why is it important to take care of it? The liver has many roles in your body, and you can't live without it. It digests food, it regulates energy, it helps you build muscle, it breaks down toxins, it helps fight infections, process medication, store vitamins, and even help your blood clot. Next slide, please. So there are many hepatitis B-related health disparities in the world. Hepatitis B does affect certain regions of the world more than others, particularly in Asia and the Pacific Islands. In the U.S., they account for about 50% of the chronic hepatitis B burden, with 1 in 12 Asian Americans affected by hepatitis B. About 5 to 15% infection rates are also found in African-born communities in the U.S. This is due to higher endemicity in Africa and Asia. Next slide. So why are Asian and African immigrant communities disproportionately affected? Hepatitis B is an ancient virus that's existed in these areas for thousands and thousands of years. There's many structural barriers as well, a poor level of awareness, a lack of testing, and lack of vaccination in many countries. Many countries also do not screen pregnant women like they do in the U.S. for hepatitis B, which can lead to the transmission during the birth process because there's a blood exchange. There's also many cultural and religious values that can affect people wanting to get tested. They play a very important role in sort of the stigma and taboos that can exist around discussing disease and wanting to get tested. There's also many myths around transmission and where hepatitis B comes from, which can be a very significant barrier. Next slide, please. So hepatitis B symptoms. There are many possible symptoms of hepatitis B. We do say that the most common symptom is no symptoms at all. Sometimes people can have sort of general flu-like symptoms, stomach pain, yellow skin or eyes, which is called jaundice. Then people might feel tired, exhausted, nausea, loss of appetite, fever. They could even have dark urine or clay-colored stools. But people can live with hepatitis B for many years, even decades, without any symptoms. It's very common to believe that they might not be experiencing liver damage or have a disease at all if they don't have symptoms, but that's very far from the truth with Hep B. We tell people not to focus on their symptoms because they're not a sign which way or the other, depending if you're infected. The only way to know for sure is with that blood test. Next slide, please. So hepatitis B can be transmitted through direct contact with blood or sexual fluids. Direct blood contact can come in the form of contact with unsterile medical equipment, which may contain microscopic particles of the virus, sharing needles, which could be infected with Hep B, even household contact, such as sharing razors, sharing toothbrushes, and even earrings with any possible contamination with blood. Also, in many other countries, tattooing, piercing, roadside barbers, scarification, and circumcision practices can also spread Hep B. And also unprotected sexual contact can result in a hepatitis B infection. We do get a lot of questions about hepatitis B being in tears or other fluids. It's not spread casually. Hepatitis B is not in tears, saliva, or sweat. Next slide. So hepatitis B can be prevented. There is a very effective vaccine for Hep B. It was noted as the first anti-cancer vaccine because hepatitis B can lead to liver cancer, and the vaccine can prevent that. So there's a very safe and effective 3-dose vaccine, and there's 2 brands. One is called Energix B, made by GlaxoSmithKline, and there's also Recombovax HB made by Merck. These are the 2 most commonly available vaccines. They are about 3 shots over 4 to 6 months. And now there's also a new 2-dose vaccine, which can be completed with 2 shots in 1 month, and that's called Hepatitis B, made by Dynavax, and that one's only approved for adults 18 plus. But this is very exciting for us because now a lot of people can be lost to follow-up with that 4 to 6 months trying to get 3 shots. With Hepatitis B, you can get 2 shots in 1 month and be protected for life. It's now covered by Medicaid. Physicians can also order it to their practices, and it could be accessible that way. We also know that it's available at Sam's Club. Because it's so relatively new, it just came out in 2018, I believe. It's still a little bit difficult to access, but it is available in Sam's Club and by special order. You also play an important role in promoting Hep B vaccination. It should be promoted to adults and family members who have hepatitis B. Next slide. Certain people are more at risk for hepatitis B. These include people who are born in regions where hepatitis B is more common, where the endemicity is greater than 2%. You can see on the graph here, any region in the darkest regions are high risk for Hep B. Sexually active individuals with more than 1 sex partner in the last 6 months could be at risk for hepatitis B due to unprotected sex. People who inject drugs are also at risk. Men who have sex with men, kidney dialysis patients, people who maybe have HIV or hepatitis C due to similar transmission modes, healthcare providers and emergency responders due to that possible exposure to blood, children adopted from countries where hepatitis B is more common, inmates and staff of correctional facilities, also residents and staff of developmentally disabled persons. Next slide. So hepatitis B and the opioid epidemic. We're seeing a rise in new acute cases of hepatitis B directly tied to the opioid epidemic in the U.S. So for the first time since 2006, the number of reported cases of acute hepatitis B across the country has risen, nearly 20% in 2015 alone. So where is it happening? It's happening in regions where the opioid crisis, where states have been hit hardest by the opioid crisis. So in Kentucky, Tennessee, and West Virginia, they saw a 114% increase in 2009 to 2013. North Carolina saw a 56% increase. Maine saw the highest increase with nearly 500%. So this is really shocking, and that's due to, I'll go into it a little bit more later, but about most adults not being vaccinated for Hep B. It's mainly impacting rural communities and even a younger population under 40, non-Hispanic whites, 30 to 39 years old, and injection drug users. Next slide, please. So this map just demonstrates where the acute cases have risen in the U.S. In 2015, you can see the darkest regions have the highest new rates of hepatitis B, with Maine being the highest increase. Next slide, please. Now we'd like to go into another poll question. So we're very curious, in the last 12 months, has your jurisdiction seen an increase in new hepatitis B infections? Okay, so thank you everyone for your responses. It looks like many of you are unsure if there's been an increase in new infections. About 28% said no and 27% said yes, so that's very interesting. That brings us to our next slide to address why we're seeing this rise in acute Hep B nationally. So as I mentioned before, the vaccination rate in the general population in the U.S. is still relatively low. It's only about 25%. And that's mainly young people and healthcare personnel. So as you can see, about 60% of healthcare personnel have been vaccinated. That's due to many employers requiring the vaccine series to work in healthcare. Other groups that may be vaccinated, people with other chronic liver diseases, such as hepatitis C, may be vaccinated, travelers, diabetics. But for the most part, in general, most people have not been vaccinated. Next slide, please. So the U.S. did develop a universal vaccination program for infants beginning in 1991, and there were also subsequent catch-up programs for school systems. So many people in the U.S. around 30 years old and younger have most likely been vaccinated. The problem is many people do assume that they've been vaccinated if they're outside of that group, and that can lead to a false sense of protection. Again, many healthcare workers have been vaccinated, but most general population has not, and this creates opportunities for transmission and spread of disease. And it can also be more complicated if people have hepatitis C and HIV, so it's really ideal to prevent Hep B infections in the first place. Next slide, please. So if someone has been exposed to hepatitis B, there are precautions that they can take to possibly prevent an infection. There is a shot called the hepatitis B immune globulin, also known as post-exposure prophylaxis, that can be taken within 24 hours to prevent an infection. It may also be helpful for someone to get a dose of the hepatitis B vaccine along with the prophylaxis for added protection. For those who have completed a dose of the hepatitis B vaccine but have not completed it, they should go ahead and get another shot and a dose of HBIG. Unvaccinated people should get both shots as well, and if someone has received all 3 doses but has not received a titer, they should also get both shots. The only people who don't need to do anything are those who received all 3 doses and received titer testing to prove immunity afterwards. Next slide, please. So diagnosing hepatitis B. There are 2 kinds of hepatitis B infections, acute and chronic infections. The age when someone becomes infected determines what type of infection they will have. So acute infections, people usually get them as adults. They usually become infected for less than 6 months. And due to their developed immune system, they're able to fight off the virus. And because most people don't have symptoms, some people may become infected and not even know. And there's also chronic infections, which is an infection that lasts for life. This is more common in the world, usually occurs by getting infected during childhood or as a baby, during mother-to-child transmission, and chronic infections usually last for life and need to be managed over time. Next slide, please. So again, acute infections usually last less than 6 months. They can last up to 9 months, but usually 6 months is sufficient for the body to clear it. It does require getting retested for the virus 6 months after the diagnosis date. And usually people are not treated with antivirals during this time. The body's own immune system is usually enough to fight it off. Sometimes patients can have very high liver enzymes, which indicate liver damage. In rare cases, they will be treated with antivirals short term. But for the most part, it's just a waiting game. Next slide. Chronic infections require ongoing management and treatment, possibly by a doctor. They should be managed by liver specialists or primary care physicians who are familiar with managing Hep B. Usually they're recommended to see the doctor every 6 to 12 months, and it will include yearly or 6-month screening for liver cancer. Some chronically infected individuals do need treatment, but not everyone does. So that's why monitoring over time is very important to take treatment at the right time when it's recommended by a professional. And there are very effective treatments available now. They keep hepatitis B under control and they prevent liver damage. Usually when people begin treatment, they'll be on it for life, so it's an important decision to be made with a healthcare professional. Next slide. Outcomes of a chronic hepatitis B infection. Left untreated, 1 in 4 people may develop liver disease or liver cancer, so it's very important to monitor it over time. Hepatitis B causes nearly 900,000 deaths each year worldwide due to cirrhosis, which is scarring of the liver, and primary liver cancer and liver failure. Hepatitis B is the #1 cause of liver cancer in the world and is the second deadliest cancer globally after lung cancer. In the U.S., primary liver cancer is the only cancer that's still rising, and it has very high mortality rates. So with a 5-year survival rate of only about 16%. So really catching hepatitis B early and monitoring it and managing it over time is so important in preventing cirrhosis and liver cancer. Next slide. So now we'd like to go on to treatment and management. It's a daily pill called an antiviral that will be taken for life once it's started. Usually there's low side effects, but it is very important not to start and stop medication. It could cause liver failure. Again, people should be monitored very closely by a doctor while they're taking it and if they're advised to stop taking it. People who take treatment before they need it will not benefit from it. Many times people just want to be on a pill, but it will not be helpful to them if they don't need it. A liver specialist has to evaluate that. They'll take additional blood tests, they'll do a liver ultrasound and even a biopsy to better understand their current health condition. A healthy lifestyle is very important when living with hepatitis B. It's important to avoid alcohol and cigarettes, to be aware of medications that could harm the liver, to eat a nutritious, low-fat diet that includes many fruits and vegetables, a lot of lean meats, and avoiding fatty and fried foods. It's also very important to get regular physical activity and stay at a healthy weight. Next slide. So now we'd like to ask another poll question. Please indicate which hepatitis B cases your health department refers to continued case management. We know this might vary depending on your capacity and funding. So the choices are perinatal hepatitis B cases only, new hepatitis B cases, perinatal and new cases only, chronic hepatitis B cases, or all cases. Okay, so it looks like it's pretty evenly split at around 35% for all cases being followed up on, and also about 35% follow up on perinatal only. Only about 2% follow up on only new cases, and 23% follow up on perinatal and new cases, and 4% chronic only. Thank you. So understanding how to interpret hepatitis B tests is very important. It's also very confusing. So these 3 tests are needed to understand someone's hepatitis B status. All 3 tests can be run from a single blood test. So there's the hepatitis B surface antigen test, the HBsAg. That's the test that's testing for the actual virus in someone's body. There's also the anti-HBC, which is called the core antibody, and this tests for an infection in someone's body at any point in time. So even for people who've recovered but have been infected at some point, they'll also be positive for this test. And the anti-HBs, which is the surface antibody, tests for protection against hepatitis B, and this can be due to recovering from an infection or from the vaccine. Next slide. So we have a helpful chart on our website to help with interpreting hepatitis B test results, but I'll just go over it now. People can be immune through natural infection, so that's recovering from a past infection. Those people will have surface antibodies that protect them from future infections, and they'll also have core antibodies as a marker of prior infection. People who are immune through vaccination only will only have that surface antibody. And people who are actively infected will be positive for the surface antigen, which is the actual virus, and they'll also be positive for that core antibody because they've had Hep B in their body at some point. There are certain test results that would require additional testing that don't fall into traditional categories. So if somebody was hepatitis B core antibody positive only, that would definitely require additional testing because it's an unclear test result. Next slide. Oh, and we have included in the handout section a helpful fact sheet that's printable that you can use and keep in your office if you need help interpreting test results. So there are many gaps in addressing Hep B in the U.S. Only about 30 to 35% of chronically infected people are aware of their Hep B, again, due to no symptoms primarily. Many providers don't know that they should be screening certain risk groups for hepatitis B, so that screening doesn't happen. And there's also less than 10% of people who are infected actually get diagnosed, are able to access care and receive appropriate treatment. And I'll go into a care cascade in the next slide. There's also a lack of primary care doctors, knowledge of healthcare system. It's very important to be considerate of culture and language barriers that may prevent people from getting screened as well. Next slide. So this care cascade shows the number of chronic hepatitis B infections in the U.S., which is about 1.4 to 2 million people. And then it shows you the number of people who are aware of their infection, which is all the way down at 400,000 to 600,000. Getting smaller still, the number who are eligible for treatment, because not everyone needs it. But then the number who actually enter long-term management is only about 200,000. And the number of people who actually receive prescriptions is only about 50,000. So there definitely is a disparity in the number of people who are diagnosed to the number of people who are actually receiving care and treatment that need it. Next slide. Additional barriers to elimination of hepatitis B. It's definitely multi-pronged here. So there's barriers to getting vaccinated. There can be issues with the availability of the vaccine, also the cost. Sometimes that can be a barrier for people, especially since it's 3 doses usually. It can be difficult to complete the series. A lot of people are lost to follow-up because it is usually completed over 6 months. Again, most people haven't been vaccinated, which leads to opportunities for infection. There are also many barriers to getting tested. There's a lack of awareness about hepatitis B. There's a lack of testing, and there's a lot of stigma and fear around getting tested, what it means to test positive, what are the next steps. There's also many cultural and religious barriers. There's a lot of taboos to discuss illness in many cultures, so that can serve as a barrier to wanting to get tested in the first place. There's beliefs around the causes of illnesses and what kind of person might get a disease, which would lead someone to not want to be tested. There's language barriers that can prevent people from talking about Hep B with their provider. There can also be a mistrust of medical systems, which can play a factor. And also just the simple nature of hepatitis B. It's asymptomatic, so that can lead someone to not want to be tested if they feel fine. There are also a lot of myths around transmission of Hep B and myths around what it means to manage it over time. So people may be worried about what that means, thinking it's a death sentence. There's also structural barriers such as someone's health insurance status. They're not going to go out to get tested and vaccinated if they don't have insurance or if they don't want to interact with the system. Also, the U.S. healthcare system can be complex, and many people may not have a primary care doctor to get tested at. Next slide. So we'd like to ask another poll question now. Does your health department fund or provide any technical support, education, or other screening services to providers to conduct hepatitis B screening? The options are yes, technical support only, yes, educational efforts only, yes, screening efforts only, all of the above, or no support at this time. Great. So it looks like some people provide educational efforts only. Some provide all of the options, which is wonderful: technical support, education, and screening. And many of you don't have the capacity to do any of these at this time, which is understandable, especially due to budgets. But that's very interesting, so thank you for participating. So we'd also like to know if your health department may be interested in receiving more information about joining local Hep B United coalitions, which may allow you to expand your efforts in screening and education. Great. So it looks like about 70% of you would be interested in linking up with a Hep B United coalition near you. So I'll go, in the next slide, I'll describe how you can do that. So if you visit hepbunited.org, we have a local partners tab, which will show you a list of all the cities and states where we currently have coalitions. And we would love to link you up to our partners there. They would be happy to connect with you, and we can see if you may be able to participate in their coalition and get additional assistance. Also, feel free to email connect@hepbunited.org for additional help and questions. Next slide. We also want to provide some resources for you. NACCHO has a wonderful hepatitis B toolkit specifically for health departments, and that's available on their website. We also have, from the Hep B Foundation website, a large library of printable fact sheets, and many of them are available in multiple languages. So those may be useful in your educational efforts. Please also subscribe to the Hepatitis B Foundation newsletter, Hep B United, and NACCHO newsletters to stay up to date. And also stay tuned for our part 2 of our webinar for additional resources and hepatitis B tips. Next slide. All right, so thank you everyone for your attention today, and feel free to use us as a continued resource. Feel free to email me and also follow up on Hep B United. Thank you.
Great, thank you so much, Sierra. That was a fantastic presentation. We'll now begin our question and answer portion of the webinar. Please submit questions for Sierra or myself in the chat box. And Sierra, we've had a couple come through already, so just to get us kicked off, the first question we received was, can you restate the best procedure post-exposure for individuals who have received a full immunization series but did not have titers done to prove immunity?
So in that case, a dose of the post-exposure prophylaxis and a booster shot of the vaccine would be recommended, just for extra protection, and both within 24 hours of exposure, ideally.
The next question is, will Hep B United have an annual summit or conference this year?
Hep B United does have an annual summit, but it is invite only, and it's only available to partner organizations and lead coalition members at this time.
The next question is, our state provides Hep B virus testing to populations at risk, including people who inject drugs but not vaccination. Does your organization know of any pathways to increasing assistance to local health departments to fund more vaccinations?
So I would say check out government sources, HHS funding. There may be opportunities to link up with opioid-related grant funding. Because that's such a hot topic right now, there can be opportunities through harm reduction through those types of pathways. Government funding is the only source I'm aware of right now, but I'd be happy to follow up if I can do some more digging on that.
Great, thank you. We have a question. Is hepatitis B virus found in breast milk?
That's a no. The only risk that there could be with breastfeeding is any possible cracked nipples where there could be blood. But if the baby has begun the vaccine series beginning at birth, That's very important and can help prevent the transmission. But for the most part, just making sure that the baby's receiving the vaccine on the recommended schedule and being aware of any cracked nipples, which could be blood contact.
Great.
But no, it's not in blood. It's not in breast milk directly.
Thank you, Sierra. The next question is, do you have slide decks that can be used for education for providers?
We do have a large library of slide decks on the Hep B United website, so I would suggest following up there.
Great, thank you. The next question is, if someone is allergic to yeast, should they get or not receive the hepatitis B vaccination?
I don't think that would be an issue for receiving the Hep B vaccine, but I'm not a nurse, but I've not been warned of any possible problems with that.
Great, thank you. The next question is, what are recommendations for someone who received hepatitis B immunization at birth, no titer done, but now entering a high-risk occupation?
So we've been assured by the best experts in the field that vaccination given on the correct schedule will last for life. That being said, your titers can go down over time. So just getting a booster shot of the vaccine, which is not a special shot, it's just another dose of the vaccine, that should be enough to boost your titers over the recommended number of 10. So if you get a booster shot, wait a month and get your titers redrawn, they'll usually be well above 10.
Great, thank you. The next question is, what makes a chronic hepatitis B case eligible for treatment?
So the treatment guidelines are rather complicated. They definitely should be interpreted by a liver specialist to make those recommendations, and they're based on how active someone's hepatitis B is, which is called their DNA level, also based on any signs of liver damage, which would be through their ALT and AST numbers, and also a liver ultrasound and even a biopsy. So there's very specific treatment recommendations that would be better left to a liver specialist to make that recommendation.
Great, thank you. Next question, what makes a chronic hepatitis B case eligible for treatment?
Oh, I think I just answered that one.
Sorry, we're getting flooded with questions, so we're trying to work through them. So thank you so much for your patience.
No problem.
The next question is there an algorithm to help me figure out if a case is Hep B, acute confirmed, and Hep B chronic?
So there is a blood test to determine if it's acute or chronic. It's called the hepatitis B core antibody IgM and IgG. If the IgG is positive, that usually indicates a chronic infection. If the IgM is positive, that usually indicates an acute infection. That being said, those tests are not usually the most reliable, so we usually recommend people getting retested for the hepatitis B surface antigen 6 months after their first test. But if the doctor has run those IgM and IgG tests, that will usually give you an idea as to whether it's acute or chronic.
Great, thank you. The next question is, can you explain the hepatitis B e-antigen test?
So the hepatitis B e-antigen test usually shouldn't be run until someone's been diagnosed. It's a measurement of how infectious someone is. So being e-antigen positive basically means that their viral load is very high and they're able to transmit it to others very easily through blood and sexual fluids.
Great, thank you. We did get a request to move one slide back. Folks are trying to get your contact email one more time.
Great.
Great, thank you. There is a next question around access to the slides and a copy of the webinar.
Yes, the slides and the webinar recording will be available on the Hep B United website, and we'll also email it out to you once we get that up.
Thanks, Sierra. The next question is, if a pregnant woman has a positive hepatitis lab during pregnancy, will the infant automatically be recommended to receive HBIG?
So that infant would definitely receive, it's called HBIG, which is that post-exposure prophylaxis. And they would also receive the vaccine within ideally 12 hours of birth, and then they would follow up with the additional 2 doses. But it's very important that they get that dose of HBIG and the vaccine and the entire schedule, and the mother may require management throughout pregnancy. Sometimes pregnant women are treated with antivirals during their last 3 months, which can be an extra precaution to lower her viral load and prevent transmission.
Great, thank you. The next question is, some sources are refraining from saying that people can become immune after clearing natural exposure to Hep B. What are your thoughts on delivering this nuanced material to non-clinical communities?
So the question is wondering about if people can become immune from recovering, I believe. So if someone has had hepatitis B but recovered, they create their own antibodies similar to people who have been vaccinated. I'm sorry, Michelle, what was the other part of that question?
It was, what are your thoughts on delivering the nuanced material to non-clinical communities?
I would say refer to our fact sheet library. We have a lot of helpful fact sheets that are available with more easy to understand information. I'm assuming by non-clinical communities you mean like community members, but just breaking it down and letting people know in simple, plain language what it means, what antibodies mean, what it means to be protected. But I would say refer to fact sheets that we have in our library would be very helpful for educating the community.
Great, thank you. The next question is, I am a public health nurse currently following a patient that had all negative Hep B labs, but a Hep B antigen. What would this indicate?
Could you repeat the question, please?
Yes, sorry. I'm a public health nurse currently following a patient that had all negative Hep B labs, but Hep B antigen. That was positive. What would this indicate?
Yeah. So we have had a few calls about that on our hotline. So a lot of times providers don't know which test to order, so they will throw on the e-antigen. It really shouldn't be ordered unless someone has been confirmed that they have Hep B, because it can likely be a false positive. So that's what I would say. It's most likely a false positive. And I would also check to confirm that all the tests that they had, hopefully they were those 3 tests I said, the surface antigen, the surface antibody, and the core antibody. And if all of those were negative, and except the e-antigen, I would say most likely a false positive.
Great, thanks, Sierra. The next question is, if the pregnant woman initially had a positive lab early in pregnancy, then has a negative Hep B S antigen lab at admission for delivery, will the infant receive PEP?
So that would indicate that the woman was acutely infected and most likely cleared it while she happened to be pregnant. As a precaution, the baby should still get HBIG. It's pretty available in the U.S., so I would say as a precaution, definitely recommend HBIG, which is that post-exposure prophylaxis, and the vaccine at birth, followed by the additional 2 doses.
All right, so we did get a follow-up question from some sources are refraining from saying that people can become immune after clearing natural exposure to hepatitis B. What are your thoughts on delivering this nuanced material to non-clinical communities? And as a follow-up to the natural clearance of Hep B, this person is referring to the possibility for reactivation of Hep B infection during chemotherapy.
Yeah, so when people have recovered from hepatitis B, because that core antibody is always positive, there's this very, very small amount of the virus that still lives in your liver. And certain times, especially in cases of taking immunosuppressant drugs like chemotherapy, it can cause hepatitis B to reactivate. In those cases, they would reactivate and they would now have a long-term chronic infection that's active that they would need to monitor over time. Did that answer all of the question?
Great, I believe so. And if not, we can have that person respond, and we'll make sure we follow up.
Yeah, absolutely.
Thanks so much, Sierra. The next question we just received was, do you know anything about possible interference of co-infection with hepatitis C and hepatitis B lab results, particularly IgM?
So hepatitis B and C are separate viruses that have separate tests, so usually they wouldn't interfere with one another in terms of test results.
Great, thank you. Our next question is, are all people, both acutely and chronically infected, able to transmit the virus to others?
Yes. So in either case, when someone's actively infected, the virus is in their body and in their blood and sexual fluids, so they are able to transmit it to other people, no matter whether their infection is short-term, which is acute, or long-term, chronic.
Great. The next question is, what types of precautions should I recommend to people who are infected to prevent the transmission to others?
So people who are infected can just be aware of any open cuts or sores on their body, cover them, and also have protected sex. Also be aware of do not share razors, don't share toothbrushes, don't share earrings. But any type of casual contact, hugging, kissing that does not involve blood, eating with family members is all okay and safe and does not transmit Hep B. So just be aware of any blood and sexual fluid exposures.
Great, thanks so much, Sierra. The next question is there a rapid test for hepatitis B like there is for hepatitis C?
No, unfortunately, we do not have a rapid test for hepatitis B. That would really be a game changer in terms of testing. Right now, it's only a blood test. In the U.S., that can be ordered through Quest or LabCorp as the main labs, but it does require ordering by a physician. There's no quick rapid test, which is very unfortunate.
Thank you. The next question is, where is the HEPLISAV vaccine available?
So again, because HEPLISAV is still so new, it can be difficult to get. We do know that they have a partnership with Sam's Club, so it would probably be available through the Sam's Club pharmacy. If someone did really want to get it, I would suggest calling local hospitals to see if they have it on hand, and also local primary care offices and specialists. It really would vary depending on the area.
Great, thank you. The next question is, are there any hepatitis B resources available in other languages?
Yes, so on our fact sheet website library, we have many different languages for our fact sheets, many different Asian languages. That's mainly our translations. We also have some in Russian and Romanian, Spanish and Mongolian. Yes, so we do have multilingual resources that are all printable in that library.
Great, and one of our final questions is, how can I become more involved in hepatitis B work? Are there any opportunities to get funding to do this?
Yeah, so again, I would suggest trying to go to the Hep B United website and seeing if there's any local coalitions near you, and shooting us an email to see if we can link you up with them. And then I would also suggest searching for funding sources online. Government funding would be my best bet. Yeah, but I would say Hep B United is a good place to start.
Fantastic. Thank you so much again, Sierra. At this point in time, I believe that was our final question. For participants whose questions we might have missed, please feel free to forward those to the emails, either Sierra or mine, which we'll put up towards the end of the presentation. And we'll try our best to reach out to you if we happen to miss that. At this point in time, I also wanted to draw your attention to some upcoming webinars that are part of the series. We hope that you found today's information informative and valuable to your work, and we'd also like to remind participants to join for these next 2 installments of the webinar series. The first being exploring national and local approaches to perinatal hepatitis B prevention, which will be held on May 1st. And then hidden consequences, the opioid epidemic and rising hepatitis B rates, will be held on May 22nd. In the handout section of this webinar, we've included the flyer for the webinar series that includes the registration links. Lastly, we would like to invite you to complete the online evaluation to provide feedback about your participation in this webinar. We'd like to thank our speaker one more time, Sierra, and really thank everyone for participating in today's webinar. Don't hesitate to contact us with additional questions or requests. And thank you again for your attention, and have a great rest of your day. Thanks so much all for joining us today.